Excuse the interruption.
Thanks. Okay, so the objectives today are to describe various aspects of addiction and ways to manage patients with addictive disorders. So we're going to hear about an approach used in a collegiate setting, and then later today I'll talk about the approach we use in our physician health program here in Mississippi. We'll also discuss clinical uses and pharmacological and physiological differences of sedative hypnotics, including side effects and toxicity, and recognize and minimize the risks of prescribing opioids, as well as employing and describing the recently released CDC guidelines. Fourth, we'll discuss the importance of collegiate recovery programs and the intertwined relationships between prescription drugs and college students. And then the last objective is to recognize the societal pressures and perspectives, as well as pharmacological and manufacturing strategies surrounding the use of amphetamines. That was a mouthful. Does anybody have questions before we start? Okay. So our first speaker today is Mr. Blake Schneider, who is the program coordinator of the Collegiate Recovery Community at Mississippi State University. He received his master's in communication studies from the University of Alabama with an emphasis in organizational communication. As a graduate teaching assistant of public speaking, he learned how to foster a collaborative environment among college students and the qualities required to be an effective public speaker. He has experience working in recovery settings, including recovery residencies, inpatient programs, CRC at University of Alabama. His goals include providing a true college experience to students of the CRC and recruiting new members from all walks of life. Please join me in welcoming Mr. Blake Schneider.
Good morning. How's everyone doing? Come on, Hattiesburg. We can do a little bit better than that. Good morning. Good morning. Wonderful. So by show of hand, how many of you are doctors? Wonderful. I am severely outnumbered. That's fine. That's cool. I've actually been looking forward to this moment for quite some time because I have a few doctor's jokes prepared for you. No, I really don't, but variety is the spice of life. And what a story you'll have when you'll go home. I can already hear the dinner conversation. Sweetheart, you know that SMA thing I went to? Yeah. Listen to this. There was a master's level graduate who started it off. Gasp! Oh my God! Did he use profanity? Did he use crude language? No. It was fine. But I'm looking forward to it. I'm obviously not a doctor. However, Discover does think that I am, because you can just use whatever prefix you want. So every month when I pay my Discover bill, it says Dr. Blake Schneider. I'm like, okay, I spend like a doctor, but I don't have that money. Anyways, I'm here to talk about the benefits of a collegiate recovery program, a little bit of the trends as far as prescription drug abuse with college students. And so those are my two main objectives, to talk about the benefits of recovery and also talk about some of the national trends as well. I hope to take up most of the time, but I do want to leave some time at the end for questions as well. And I really enjoy that part where it talks about me teaching public speaking and all that stuff, really high expectations. I'm really about low expectations, because if they said it's just this guy and he's going to do okay, and I exceed that, then you're like, oh my God, he's amazing. But anyways, for those of you who are completing CMEs, this first slide is somewhat important, so I would remember that if I were you. There are thousands of substance abuse prevention and treatment programs, but only a handful of collegiate recovery communities. But we're working on it, right? So we're getting there. A little bit of the history. It started in 1979, I believe, at Texas Tech, and it grew slowly. By the early 2000s, there were about 20 or 30 collegiate recovery communities, and in the past 10 years, there's been an increase to 170 collegiate recovery communities across the nation, which is very encouraging. About 120 of those are established, 50 are in the startup phase. So, a little bit about substance use disorders in a collegiate recovery, or collegiate setting, that is. And I wish I had the prescription drug facts, however, I do, but I just kind of want to talk about like the dire need for collegiate recovery. So the most startling statistic to me is 1,800 college students die per year due to alcohol use, which is 3 to 5 students a day nationally. That's quite a bit. That's a substantial amount. With that being said, the National College Health Association recently conducted a survey. We did one at Mississippi State, and we found that about 3% of college students abuse prescription drugs in the past 30 days, which 3% doesn't sound terrible. However, 3% of 20,000 students is about 600 students, which is a fair amount. So there does need to be a good amount of education and awareness raised around this issue. So, substance abuse and addictions take a toll on students and universities, obviously. Something that's very kind of was startling to me is studies report that more than 40% of student attrition involves substance abuse, which is, I mean, that's a big number, right? That's almost half of a student who drops out is due to substance abuse disorder. That being said, only 4% of those students will seek help related to those drug and alcohol problems. So there's a pretty big gap there in between 40% and 4%, right? It affects retention, waste resources, fail university missions, fail students. So there needs to be something to be done, and collegiate recovery is kind of spearheading that movement of how we best help these students who are struggling with substance use disorders. So with that, with a supportive environment such as the CRC, a minimum of 50 students who seek help could be retained and supported in their recovery, right? So not just that 4%, if we could increase it to 50, which is a very large jump. So the need for collegiate recovery is pretty great. CRC provides a safe, supportive, and positive system for students in recovery and those seeking recovery. So a little bit about the kind of numbers, if you will. So Texas Tech University did a study, and they reported that 80% of the estimated 213 addicted students sought help on campus from the collegiate recovery community. That said, grades and retention rates are significantly higher than the general population of students. If you are filling out a CME, I would remember that as well. But that being said, by being able to keep those 83 students, they are able to keep around $500,000 annually in direct tuition for the university, which is great, right? I mean, that's great for us kind of arguing our cause on campus when we can say, hey, if we build this program, if we sustain this program, if we support these students, we can retain $500,000 for our university. Any questions so far? Rocking along, we're good. Streaming live too, so anyone out there live watching this, I hope you're enjoying. So, a little bit about what the overall goal of a collegiate recovery program is. It's a safe place on campus for students who are in recovery from drugs and alcohol, right? And so there are students right now at Mississippi State that receive year-round support from our CRC. And also, with the CRC, it brings a reputation, you know, it brings students to Mississippi State, because if you have a recovering student looking to go back to school, they're going to choose a school that has a CRC over one that doesn't 10 times out of 10, because we're able to provide that recovery support for students looking to come back. It is also a second chance program, right? So it's a lot of times it's for students who failed out of college, who had to go to treatment, whatever that looks like, and it's a chance for them to go back. So that being said, it's a very meaningful experience for someone to be able to come back and achieve academic success like they never have been before. And this also brings students to your respective university as well. So let's get into a little bit of what collegiate recovery community is, kind of the nuts and the bolts, if you will. So it's a national movement. It's an engaging and innovative field, and it addresses the unique challenges recovering students face in a collegiate environment. So what does all of that mean, right? It sounds kind of nice on the slideshow. But it's a new and it's a growing movement. Again, it's more than tripled in the past 10 years. You know, and it addresses this kind of issue that's never been tackled before, because in years past, administration from colleges never really wanted to acknowledge that there was a drinking or a drug problem on their campuses, right? They just kind of buried it and kept moving. But now, administration is seeing that, hey, we do have these students who are struggling, and how can we best help them? And so that's kind of where collegiate recovery comes in, and we can help these students who are struggling. We can give them that second chance to come back to school. So, it is institutionally sanctioned community or program that promotes academic achievement, social engagement, and long-term recovery. So this academic achievement portion of the program is very vital, right? Because that's how we kind of prove our worth on campus. That's how we say, hey, I might be in recovery from drugs or alcohol, however my GPA is higher, I'm achieving academic success. That's how we kind of argue our place on campus. It's an abstinence-based model for the most part. It certainly is at Mississippi State. So, and we cover all forms of recovery, whether it's a process addiction, substance abuse, whatever that looks like, we provide that support to students who are in recovery. And it's a kind of a mutual aid support as well. So the biggest thing I think for me is students being able to support other students and being able to empathize and say, hey, I've been there, I know what that looks like, I'm struggling with this test as well, I'm struggling with this recovery thing as well, and they can come together and support one another, which is a beautiful thing. So, the areas of support that there typically are with a well-established collegiate recovery community program are these right here. And so, if I briefly could, I'd like to talk about just kind of how we try to support our students at Mississippi State in these ways. So, we have that academic support, right? So we refer people to the advising center. We try to get them plugged in with other students so they can take classes together. We have a referral to disability support services. We have that kind of set up as well. So a student will go and get evaluated by psychiatrists, psychologists, whatever that looks like. Tell them that they're in recovery, and then that doctor will make recommendations based on them being in recovery of certain academic supports that they could use, right? And then they can take that to disability support services, and a lot of our students have received extra test time, priority registration, access to lecture notes, those kinds of things, right? So we really try to support that academic part because that's what students struggled with the most when they were, drinking and using drugs, and so we want to be able to provide that support. We provide career support as well. I write a really mean letter of recommendation for my students. I love doing that. But we get them plugged in with the Career Center. We try to teach them interviewing skills, proper etiquette, which dinner knife to use, all of those good things. Social support, right? It's not easy to go back to school and be around thousands of people. College has been described as a sobriety hostile environment, and so when you can find people who are your age and doing the same thing that you're doing, it's a wonderful thing, and it's very crucial insofar as sustaining someone's success. And so really for me, where the rubber meets the road is the community in and of itself. So the students make it what it's supposed to be. They provide each other that support. And as well, we have financial support. So each student who enrolls at Mississippi State in the CRC gets an academic scholarship just for being in recovery, which is a wonderful, wonderful opportunity to provide them. And then obviously recovery support as well, right? So we have things such as basic life skills seminars, anonymous meetings at the house, teaching basic coping skills with how to get through life. So we have these support structures in place to make sure that students don't slip back into substance use disorders so that they don't go back to using prescription drugs, that sort of thing. So kind of the integral parts of having a CRC is you have to have a administrative support, so you have to have people higher up who support it, otherwise it's never really going to happen. You have to have a staff, so someone who's spearheading this thing, aka me. You have to have students, obviously, you can't have a CRC without students. And you need physical space as well. All of these things are very integral insofar as the success of a CRC. So if you're doing CMEs, I would remember this slide as well. The four integral, I know I have 5 here, the 4 integral parts are administrative support, designated staff, designated space, and weekly programming. So what the CRC is not, and it's a little bit interesting, kind of presenting at this conference because I'm not on the treatment side of things, I'm more on the retention side of things, but I'm trying to tailor it to y'all. But what the CRC is not, so it's not addiction treatment, we're not a treatment center, we're not, we don't, try to arrest the disease in any way. It's not a replacement for the 12 steps, and it's not group therapy. It's a support program for students who are doing the deal, who are going to meetings, who are showing up. With that being said, we do have a 6-month minimum requirement in order to be a part of our community so that we can maintain the healthiness of it, so that we can recruit students who are in recovery doing the deal and who will have a positive impact on our community, who will really bring something to the table. Fun fact, I get to interview incoming students, which is always fun to get to ask them what they bring to the community and what have you, which is a trip for me because a lot of my students are older than me. Questions so far? Comments? Concerns? Wonderful, all your bright, shining, smiling faces. Yes?
You said right at the beginning, it's 1,800 college students die every
year from alcohol alone.
alcohol alone.
3 to 5 students a day.
And the program is mainly for kids that drop out and come back, but not graduates that drop or flunk out and come back.
No, so we can have graduates as well. We have graduate level students, is that what you're asking?
So they had a problem for 4 years and they graduate, they get out there and they flounder and
Right,
they
so,
have a problem all along.
right. So the question is, if they struggle for 4 years and they want to come back, if they can be a part of the program, yes?
That, or you can refer them to, well, there's another group of, for support.
Right, absolutely. So we do try to provide, so if we can provide them support once they've graduated, right?
Yeah.
Yeah. I have to repeat this because it's the whole webinar thing.
They never came forth with their problem, but they
Right.
struggled and graduated, that they found this.
So if a student struggles and comes back and they've already graduated, we can try to get them plugged in the way of, hey, there's these groups in this certain city, whatever that looks like. We can reach out to our national network, our alumni, whatever that looks like. But our program specifically on campus is for students who are in recovery. That being said, we do try to, one of the very interesting things about collegiate recovery communities is that it can really revitalize a recovery community within a college town. And those vary, right? So like in a college town, it kind of depends. You never know how good the recovery community is going to be. But that being said, we bring people who are in recovery to the university. We have functions such as sober tailgates that anyone in the community can come to. We have anonymous meetings that anyone can come to. So we have that other level of that kind of tertiary. We can try to help out the community as much as we can as well. Does that answer your question? Wonderful. Fantastic. Any other questions at all? All right. Moving swiftly along. So a little bit about where collegiate recovery communities typically fall within the university structure. 29% is within student affairs. So Mississippi State, we are within student affairs. 8% is housed in student life, 21% is student health, 13% is student development, and then 29% is other. So it's interesting, right? Every college is different, but a CRC will kind of find its place wherever that champion falls in, right? Wherever that champion is typically where it is hosted within that department. So insofar as space on a college campus of where collegiate recovery communities fall, 27% is a suite of rooms. That can be in the union, it can be in a residence hall, it can be on a building on campus, it can be 31% is a single room, and then 8% has a building, and 34% is others. It's kind of one of those things, again, where it falls, where it finds its home. That being said, I'm a very big believer in if you build it, they will come. So if you have that space, students will come. They will have that safe place on campus. In order to survive and thrive, I'm very happy to say that at Mississippi State, we have a house on campus. We have little rocking chairs on the front porch, just nice and quaint. We have free printing, free Wi-Fi, free coffee. That will bring a student in 10 times out of 10, always. So that space is integral insofar as ensuring the success of a collegiate recovery community. So some of the benefits of a CRC, and hopefully I can kind of expound upon community support that we can provide, and maybe, you know, someone who's already graduated, moved on, but it's a safe place on campus for students who are part of the program. They have study space and study hours, connections on campus, so I'm not vain enough to think that I can handle academic advising or counseling or career skills, whatever that looks like. So I really try to be the point person on campus for students so I can refer them to the Career Center or the Psychology Clinic or the Counseling Center, whatever that looks like, you know, having those connections on campus, trying to get them plugged in, right? Beyond that, academic scholarships, again, that's huge. It was such a wonderful thing for me when I was part of the CRC at Alabama, and I was kind of leery of it at first, but they're like, hey, we'll give you an academic scholarship for being in recovery, and I was like, well, all right, I can't say no to free money, you know. So that's a wonderful part of the program. So we have sober social events. So we have sober tailgates. Again, those are open to the community. We have camping trips. We have certain things in which we can do in order to fellowship with other CRCs from the Southeast and across the nation. Service opportunities. This is one way that maybe a graduate, someone who's graduated, could get plugged in, but we have a service organization under the umbrella of the CRC called Mississippi State Students About Service. MSAS is a lot easier to say, but we try to get involved in service in the community. So for instance, in the fall we raised 441 books and we donated them to a prison in Leakesville, Mississippi, which is a wonderful thing. So we can kind of branch out beyond the college environment. Conferences, recovery night, and seminars. So recovery night's an all speaker, all anonymous fellowship meetings. So the second and fourth Thursday of each month, we have a speaker come in, and they can be from Alcoholics Anonymous, Cocaine Anonymous, Narcotics Anonymous, EDA Anonymous, whatever that looks like. And they share their experience, strength, and hope, and that's open to the community as well. And it's a very non-threatening environment for someone to be able to come in. They know it's a speaker meeting. They can sit in the back if they want to, and they can learn more about, you know, what exactly recovery is. That being said, it's not really tied to any set of traditions. I mean, we do have readings and we do have traditions somewhat, but it can be more educational as well. So psychology students can come in for extra credit and, you know, listen and do a write-up or whatever that looks like. So it is a wonderful opportunity to kind of raise awareness on a college campus about recovery, about substance use disorders, because I can tell a student all day that they may or may not have a problem with prescription drugs or alcohol or whatever that looks like. But if they hear it from another student, it can be much more impactful than if I'm telling them that. So a few national trends insofar as retention and graduation rates of CRC students. So the retention rate for students institution-wide typically is within 80%, and CRC retention is 91%, right? So we have some pretty spectacular students. And again, I think that goes back to it being a second chance program, a program in order for people to you know, have that second chance. Students typically take it more seriously. And also, we have higher graduation rates as well. So institution-wide, it's 60%, whereas with the CRC, it's 89%. So those are some pretty noteworthy statistics because it shows the effectiveness of a CRC, and it also shows the benefits of recovery in and of itself. And then the rest is kind of what an annual budget looks like, programs that don't have a budget, so 20% of these programs don't have an annual budget, the cost per student, program capacity, numbers of students served, and then the amount of clean time that students have as well. So if you're doing CMUs, this is a slide that I would remember insofar as graduation and retention rates. So one of the larger parts of a CRC, one of the overall mission and vision parts is the kind of trying to have a cultural shift on campus. So through our efforts and through raising awareness on a college campus about a collegiate recovery community, we try to reduce the stigma of addiction, and we try to strengthen the local recovery community, right? So when we have our students, we can, if they're okay with it, we can typically spotlight them and say, hey, this person hit a tree drunk driving 4 years ago and now they're going to med school, right? Because for the average person, if I say, like, you know, draw a picture of an alcoholic or a drug addict, they're going to draw someone like drinking out of a brown paper bag, or, you know, someone with a needle in their arm, and they don't really realize that students can come, or people can come back and have academic success, that they can hold position of power, that they can, you know, get those seats at the round tables, that they can, you know, be important people. So we try to really, through all of that, it's a wonderful experience to educate people that people in recovery you know, do and can succeed beyond substance use disorders and what have you. Something I did want to circle back to, I talked about how 3% of college students have abused prescription drugs in the past 30 days. Those are referring to downers, so with downers and amphetamines, they're both 3%. And what I've seen personally is, and I don't know if this is just what I've seen, but typically in the middle of the semester it has to do with like the downers, the benzodiazepines. Students are taking that, you know, abusing that, I guess, in order to get through the semester. But then towards the end, the amphetamine epidemic is typically pretty awful, right? I mean, students, you know, giving it to their friends, selling it to their friends, whatever that looks like, trying to, you know, make up for a semester's worth of work. So yeah, so that's kind of what I've personally seen in my own experiences, the downers in the middle of the semester and then the amphetamines at the end of the semester when it's crunch time and they have to study. And there's that lack of understanding with students of they think, you know, they can take Adderall, Vyvanse, Ritalin, and, you know, that it's going to help them study and that's going to be okay. And like, tell people, I'm like, you're taking amphetamines, like this is like some heavy duty stuff, you know, it changes your brain chemistry, and you, if you don't have, you know, that disorder, then it's going to affect you differently than someone who does. So that's just a fun little fact. For me, you know, I've tried to provide some numbers, some statistics about what this whole CRC experience looks like. But for me, I think the most meaningful thing is, you know, telling the story of a collegiate recovery community, of having the students experience. And so I put up a few quotes that were found in a study about the impact that it had on students who came back to school. So I would never have gone to college if I hadn't found out about this program. The center made it possible that I could recover quickly and establish a good network with them. I think I would have relapsed, dropped out, or gone into like severe depression, and it played a crucial role in my first year of sobriety. So that's the kind of stuff that keeps me going when I hear how much it benefits students who are coming back to school, who are trying to achieve that academic success. Because when you hear that story, it kind of puts a face to all of the statistics. So not one size fits all, but it will fit your size. So it's different. It's kind of interesting on how it starts on a college campus. It depends on where it falls. But you know, some of the things that you will hear is we are too small. We're a small campus. We're struggling. Collegiate recovery community, it won't work for us. Our students don't believe in the 12 steps. They do believe in the 12 steps. I promise you that it works and that any school, you know, could absolutely benefit from it. Again, I mean, you retain students, you bring that money to the university, you help save lives, if you will. So it just depends, and it'll fall where it is, but really it needs that champion. It needs someone who believes in it and who will bring it to that school. That being said, we wrapped up a little bit early, but questions, comments, concerns. I'd like this to be more conversational and not a monologue, a dialogue, if you will. Yes?
I would like to just point out, Blake, that in Mississippi, we have CRPs at Ole Miss, Mississippi State, and here at USM. And I think it's important for this group to know there is a program at USM. Out of the 3 schools that currently house programs, Mississippi State is way ahead of everybody else. USM's catching up, though. They're working really hard. But I just wanted to be sure everybody knew that there is a program here in town as well.
Right, absolutely. And so again, I think it falls into, insofar as whether a program's developing or if it's established, it goes back to designated space, designated staff, and weekly programming, right? Those are kind of, when those come together, that's what makes a CRC, that's what makes it happen.
It's a good program for you to go ahead now, figure out what happens in 10 years.
Yeah.
That'd be beautiful.
Mm-hmm.
You know it's important. You're waking me up the first time. 10 years from now, wow.
Yeah. And so insofar as where it's going to be in 10 years, I mean, it's very encouraging to me because 10 years ago we only had 20 or 30 and now we have 170, so I can only imagine how many there's going to be in 10 years. And kind of on that note, it's a very altruistic movement. I mean, there is no competition. You know, when I have a student coming in, I say, hey, obviously we're the best in the state and the nation, like please come, you know, here, but, you know, check out other CRCs across the nation, see where you fit. And insofar as programs starting up, like anyone in this entire like field will help another person say, hey, this is what I've done, this is what worked for me, this is how maybe you can get it started up, and, you know, visiting with campuses and leaders on those campuses trying to convince them of the benefits of it. So I think as long as we stick together and, you know, kind of still maintain and try to prove our worth and have our voice, the sky's the limit for sure. Thank you for that. Show of hands, who did not know about CRCs before this? Oh my God, this is wonderful and beautiful.
I did know about them, but I also would like to add that these are such bright, engaging students once they get in recovery. And as a treatment provider, Pinebrook here also has a young adult program. I'm employed at Cumberland Heights in Nashville, Tennessee. We also have a young adult program. And those of us who have them have connections with universities and colleges that have collegiate recovery programs. So when we have a student finish their treatment program and they've been clean for 6 months, then we can help get them connected to a facility that has a strong program. I think that also is important for everybody to know. And the thing that I really need to impress on everybody is these students are so much fun and so bright and so engaging and so energetic. And we had a young woman from Mississippi State who last year graduated with honors. She got a full scholarship to the University of Edinburgh in Scotland. She got a graduate assistantship that will pay for a stipend while she helps to support research in human organ regeneration. So we're not dealing with street junkies. We're dealing with students who are very bright and who are part of our future. We need to be aware of that. And Blake is one of them. So.
You're looking at it, for sure. And that was one of the very interesting things for me, because I was a student at Alabama, and then this position came up at Mississippi State, and I applied, and I was able to go in and be like, hey, I was a student, you know, I was there when it was built from the ground up, and to be able to take that from Alabama and implement it at Mississippi State's been a wonderful, wonderful thing. But yes, so the students they're the apple of my eye, they're what keep me going, they keep me honest as well. They'd probably be laughing at me right now if they were here. So I always tell them I'm doing networking, and they're like, you're just at a hotel sitting at a beach or something. But anyways. Any other questions, anything else at all?
The funding,
Mm-hmm.
how does that work? How's your program funded? The slide on the cost, it said the student pays.
So the
90%
student,
of the cost.
so the student there's no cost associated with them. So the question was, where does the funding come for collegiate recovery community, and what's the cost to a student? Is that correct? So the funding, again, it depends. Every university is different. I wish it was like everyone had the same rules and it was nationally sanctioned, but it kind of falls where it is. However, a lot of schools have funding, have a budget from the university. So Mississippi State has a budget from the university, but beyond that, a lot of our budget comes from donations. And we have an unrestricted fund and a scholarship fund as well. Each year we do a fundraiser for scholarships so we can raise money for students in order to have that academic or that financial aid, if you will. And then insofar as, you know, benefits to the student, there is no cost to the student at all whatsoever. So any of the sober tailgates, basic life skills seminar, meetings, you know, whatever that looks like, it's, you know, all cost paid. And so what that number was referring to is typically how much it costs to take someone and push them through the CRC program. So what that looks like. Does that make sense? So the cost associated with having that student in the program, not what it costs them.
They don't have a financial burden.
At all, whatsoever. Yeah. Anything else for the good of the order? either y'all are quiet or I did a really wonderful job explaining CRCs. I'll take it as a compliment either way. Did I hear something over here? No? Yes, no? Wonderful. Alrighty. Well, if you have any questions you'd like to pull me aside and ask me about CRCs or whatever that looks like, please feel more than free, but it's a very encouraging field. And if there's any one thing that I look to do when I do this kind of stuff is, again, recruit members from all walks of life. So whatever that looks like, I really love raising awareness, and there's nothing quite like getting a phone call from a student saying, hey, I didn't think I could go back to school. I never thought this was possible for me, but being able to get them into school and get them plugged in, it's a wonderful, wonderful thing to have that second chance program and be able to give people a second chance, not only at school, but at life, But thank you for your time. I hope everyone has a wonderful, wonderful day.